cancer that all men should know?
So the number one symptom is seeing or feeling a mass that comes off the testicle, and it's usually a lot harder in consistency than the normal feeling of a testicle. And it's worth saying that testicular cancer is painless. And if people complain of pain, it's mainly when it's not really pain, it's more of discomfort or heaviness if the mass gets bigger. And they can grow bigger really fast over weeks and months. So the heaviness or of discomfort that from the size of the mass, that's what creates discomfort or pain. But in general, it's painless, and it's just a mass that people can see and feel come off the testicle.
Okay. Anything else? What we found was lump or swelling in either testicle, which you just mentioned. Mm-hmm. Change in how the testicle feels, which you just mentioned. And then how about ache in lower abdomen or groin?
So usually it doesn't cause like significant pain. It's most likely the testicular cancer will cause heaviness in the scrotum. So that pulling on the cord that's attached to the testicle irritates the nerve and creates this heaviness feeling or discomfort. But it's not usually severe pain.
And is it on just one side or both sides?
It's usually, so the chance of having testicular cancer on both sides is about 0.5 to 1%. So roughly 1 out of 100 testicular cancer patients will develop testicular cancer on both sides. So the vast majority, it's only one side.
Okay.
I only saw one patient that had testicular cancer on both sides at the same time.
Wow, so it's rare. Okay. And the other symptom we found, let us know if it's correct or not, is sudden buildup of fluid in the scrotum.
That's not usually the case, no. That's called hydrocele, and it's not usually happens with testicular cancer.
Okay, and then pain or discomfort in testicles, or scrotum.
Yeah, that's most likely discomfort more than pain.
Okay.
From the weight of the testicle, because they can get really big, sometimes like an orange size or grapefruit size too.
Wow, okay. So any other symptoms besides the lump?
There are rare symptoms, don't usually. So this is the initial presentation usually, if we catch it early. If patient comes with these complaints and we find a small mass, usually we catch it early. But sometimes if people ignore it, mainly because it's painless and it's spread, and this cancer is highly metastatic and spread very quickly. So the rare symptoms can happen if let's say that these patients have extensive lung mets. So their lungs will be full of testicular cancer, so they would get short of breath because the normal lung tissues are reduced to half or maybe even less than half. So they would get short of breath with minimal effort. Sometimes they can even cough blood, hemopsis, what we call it. I've seen also patients with brain mets, and they come in with seizures. They develop seizures.
Wow.
Also, occasionally when they have very large lymph node in the retroperitoneum, they can develop back pain. Yeah.
Wow. Okay. So if a man is experiencing pain on one testicle, like you said, is the more common, or not, like a little bit of discomfort or pain that radiates from the groin, that radiates in the groin area. Mm-hmm. What is that is that a reason to go to see a urologist? And what would be the right diagnostic? How do you diagnose testicular cancer, I guess is my question.
So the first thing, by the way, like pain in a testicle, this is something we see often as a urologist. And to rule out any other thing, but it's very rarely pain in the testicle is the cancer. There are several reasons that can be the cause of testicular pain, like orochitis or epididymitis, which is inflammation of the testicle, or the epididymis, which is another organ in the scrotum. That's most likely the diagnosis, 99.9%, that's what it is likely. But if they have swelling or the testicle gets bigger over a short period of time, like weeks and months, the testicle grows in size, or a lump in the testicle that feels hard, these are the main signs and symptoms to worry about testicular cancer.
Okay.
And be aware they can be completely painless. I've seen so many patients, they have had it for a year or two. And when I ask, why didn't you come earlier when you had it, when you noticed it, they said it was painless, so it didn't bother me.
Got it. So, but if they are suspicious and you know, and they want to go in, what doctor should they go to, and how do you get diagnosed?
They should go to like the most accessible. If it's a primary care physician, that would be it, or a urologist. If they have access to a urologist, that would be the person to go to. If not, and if they have to see someone before they can get referred to a urologist, then they would see the primary care physicians. And most likely they would do an ultrasound. That's the standard to imaging for diagnosing testicular cancers, an ultrasound of the testicle, and it can detect MS if it's there.
Got it. Are there any preventative measures that men can take against testicular cancer?
Well, there are preventive measures in the sense of early detection, but not in the terms of not having testicular cancer. So people who are going to have testicular cancer will develop it no matter what. It's just with the thing we can do is to detect it very early before it metastasizes, and treat it early.
Okay.
So early detection, prevention, maybe in the form of like self-examination once a month in the shower. So men, and that's recommended between the age of 15 and 40. That's where the peak time for testicular cancer in young adults and teenagers. So once a month, they in the shower, every man should examine the testicle.
Wow, so it's kind of like breast cancer, right?
Like breast cancer, yeah.
They should check themselves once a month. That's interesting, by just detecting manually,
yeah.
Right?
Exactly. Yes.
And you said age.
So what?
Sorry, go ahead.
May I quickly interject? I'm sorry, I didn't hear the ages. Could you repeat that, please? And also, if you have any tips for self-exam, that would be good to include.
Yeah. So the recommended age is from 15 to up to 40. The ultimate peak of testicular cancer is between 25 and 35. That's the highest peak, but it can happen between 15 and 40. Below 15, it's extremely rare. Above 40, it's extremely rare. So that's the age we're recommended to do the self-exam. And the way the self-exam done is with one hand. A man in the shower can grab each testicle one at a time, usually with the thumb and the middle and index finger against the skin, to have the skin stretched over the testicle and fix it. And with the other hand, he will feel the testicle to see if he feels a lump or a mass or different consistency, and perform the same maneuver on the other testicle.
That's really good information. John, are you getting that?
I'm getting that. Can I?
That's really good. Go ahead, John.
No, I'm glad you mentioned the ages, because I know it's always been known testicular cancer as a young man's disease, and I'm glad you said that 25 to 35. Is there any trends in that age group? Any trend that you've noticed in testicular cancer patients, whether they're getting older or younger, or?
Well, the trend is that it has been increasing. So every 5 years, they find that the incidence of testicular cancer is increasing. Like if we compare the incidence now to, let's say, 10 years ago or 20 years ago, we find that every 5 years the incidence increases over time. What is the cause? It's unknown. It's most likely environmental changes that cause genetic mutation that could be causing this. That's what most likely it is. But still, like at the end of the day, testicular cancer is rare, but it's just the instance, it's increasing over time.
And that's
What is rare? What's the percentage? Like,
Yeah, the percentage increases you may see over 5 years, every 5 years or so, you mentioned?
Well, it's about 10% increase every 5 years.
Wow, okay. Now, and I know in other issues, in other cancers and overall heart disease, people point to the obesity epidemic and, you know, a rise in diabetes cases and all that, but does any of that apply to testicular cancer, like the obvious things?
No, so the risk factors for testicular cancer are white race. White people tend to have more testicular cancer. And the other thing is the undescended testicles.
Right.
So there are kids who are born with undescended testicles, and we wait up to a year for the testicle to descend on its own. And after 1 year, if it doesn't descend, we do an orchiopexy, so we bring it down. So kids who are born with undescended testicle, they have a higher chance of having testicular cancer in the future.
Right.
And even regardless they have it fixed or not, just the fact that they were born with undescended testicle put them at a higher risk for testicular cancer. So bringing the testicle down doesn't take away that risk. Once they are born with undescended testicle, they have increased risk.
That was going to be my question. The surgery doesn't necessarily reduce the reduce the risk. Also, I saw, I think in the American Cancer Society on testicular cancer, they mentioned HIV infection as a possible risk factor. Is that your experience? From your experience, you've seen this?
Not that I'm aware of, to be honest. So if you look at risk factors, you will find so many. Like even I was doing some reading about testicular cancer, I found that less of a risk factor is hernia in newborn, hernia in kids, or low birth weight can be a risk factor. But I cannot tell you how many hernias I've done in pediatric urology rotations, hundreds of them.
Right.
So the odds ratio of hernia to be related to testicular cancer, I would imagine it would be very low.
Okay.
So in counseling patients, I don't really bring up hernia or low birth weight as a risk factor for testicular cancer.
Interesting.
Otherwise, you will have thousands and thousands of people worrying about it, and you shouldn't really worry too much about it. And at the end of the day, I think it's undescended testicles is the thing that we should worry about the most. To some degree, white race may be a higher risk for testicular cancer. And family history.
Right.
Having a sibling of testicular cancer put you at 6 times more risk of developing testicular cancer.
Now, that's great information, by the way. And you're probably the most famous person to come down and recover from testicular cancer is, as you know, probably Lance Armstrong.
Armstrong, yeah.
And he was a champion cyclist, and he was in his early 20s, I think, when he came down with testicular cancer, and then it spread, and he recovered famously. And out of that came a bit of a myth. I don't know if it's a myth. Maybe you can. That if you're a man and you're a cyclist, and there's a lot more cyclists out there now, that may put you at risk.
Absolutely not.
Okay, good. Please, if you get that a lot from men, or if they think it's a myth, can you talk a little bit about that? Or?
So cycling puts you at a risk of some trauma to the testicle, which can irritate the testicle or the epididymis, caused traumatic epididymitis. But to cause testicular cancer, there is absolutely no evidence that would support cycling would cause testicular cancer.
And I don't know, is there any other myth out there, misconceptions that you can think of about testicular cancer, whether it's age-related, only young men can get it? I mean, I guess the majority of them are in their 20s and maybe early 30s, but is there any other myth or misconception about testicular cancer that you can clear up for us?
Not that I can think of.
Okay.
You mentioned that if you have a sibling, you're 6 times more at risk for getting testicular cancer. So my question is, if you have a sibling who has it, what should you do? Or what should those do? Like, at what age should they get? Should you still recommend maybe earlier screening? Is there anything that these members who are, already designated high risk that they can do to protect themselves and be vigilant?
The most effective and important thing is the self-exam, and if there's any little concern, they should see a physician and have an ultrasound done. And the age of screening wouldn't change because still below the age of 15 is extremely unlikely to develop testicular cancer.
Great. So those are amazing responses. Thank you so much. This is so interesting. And I don't have any more questions on testicular cancer. I'd like to move on to prostate if we can. We have a little bit of time, but I want to make sure before I move on, John or Aaron, do you have any more questions for Dr. Elderfrawi?
On testicular cancer, I don't think so.
No? Okay. So
Thank you very much.
The only one that we had was on how it's treated, if it's non-invasive. Is it our understanding is, I guess, if it's caught earlier, it's less invasive. Is that correct, doctor?
So the treatment for testicular cancer, whether it is localized so once we have a diagnosis of testicular cancer, we do imaging of the abdomen pelvis to look for the lymph nodes in the abdomen, and the retroperitoneum, and the lungs as well. We do a CT scan of the lungs. And even it has spread, usually the first rule is to obtain tumor markers, which is a blood test, followed by removing the testicle. And the testicle has to be removed from a groin incision, which is usually like a couple of inches in length. And we remove the testicle and the cord from that incision. And once we have a pathology, there are several types of testicular cancer divided into two main groups, seminoma and non-seminoma. And depends on the pathology and where it has spread, we decide if we observe and watch the patient if it has not spread anywhere, or we consider chemotherapy if it has spread. And chemotherapy is for testicular cancer is that really, to give credit to medical oncologists and chemotherapy, it's what revolutionized testicular cancer treatment, because the most advanced testicular cancer that spread in the lungs and retroperitoneum, chemotherapy has cured a lot of these patients, and the cure rate is north of 95% of testicular cancer, thanks to the chemotherapy we give to these patients. So this is the treatment. There is usually a section of these patients will require doing a major surgery to remove all the lymph nodes in the retroperitoneum, which the standard of care is to make an incision pretty much from opening the entire abdomen from top to bottom at the midline. Now we are moving toward making a minimally invasive, doing this surgery with the minimally invasive approach using the robot. And a lot of centers are moving toward this direction, but still the difficult cases has to be done open. So this is kind of like a broad idea about how we treat testicular cancer.
And I'm sorry, but at MCI we do it both ways. Since I'm new, I haven't had the chance to do this procedure because it's not very common. Usually busy centers do between 10 and 20 every year. I know CASO has done this procedure robotically 3 times. Now, is there any innovative treatment, or is this the innovative treatment that maybe that you know of that we do at Miami Cancer Institute to treat it?
That would probably be it. Yes. That would probably be at that doing retroperitoneal lymph node dissection robotically.
Okay.
So avoid the major incision literally from the chest all the way down to the pubic bone.
But it's new, it's a newer thing, but I think, it's not something that just MCI is doing though, right? Like it's something.
Not just MCI, no.
Yeah, it's probably something that a lot of cancer centers are doing.
Mm-hmm.
Okay. Before we move on, Dr. Elderfrawi, is there anything else that you would like us to know that you want to add on that topic?
No, I think you guys covered it pretty well.
Okay, great. So if I may,